All right, a very good morning to you, and thank you for joining us once again for our glaucoma awareness program on Solid 100.9 FM. Someone will say, do you people ever get tired of doing this? But we can't get tired until everybody is taken care of. And sometimes I just close my eyes tightly and try to walk around my little room, and I find it's very difficult navigating. And so, yeah, some people don't like to imagine it, but I imagine the worst. I imagine that I lose my sight, I can't see. I imagine that somebody has to help me move around. It's definitely going to affect my work, it's going to affect my lifestyle, it's going to affect everything about me. In fact, it's going to be a totally new, different life. So that's why we're doing what we do every Friday. So glaucoma is often called the silent thief of sight, not because it screams, but because it steals quietly, slowly, and sometimes permanently. And for many people living with glaucoma, the real battle is not just the disease itself, but the medications they must use every day to preserve the little vision they have left. And even for those who have completely lost their sight, they are not free from the increased eye pressures, that come from the condition. So this morning on Glaucoma Awareness Program, brought to you by Solid 100.9 FM in collaboration with the Eye Specialist Hospital Enugu, we are shining the spotlight on an issue many patients whisper about but really understand: the side effects of glaucoma medication. Why do some eye drops cause redness, irritation, darkening of the eyelids, or even change in heartbeat? Are these effects normal? When should a patient be worried? And is there a way to manage these side effects without abandoning treatment? And of course, to guide us through this very important conversation is our trusted expert, Dr. Obin Nashiwobi, consultant ophthalmologist and a glaucoma care specialist. He will be helping us understand what the medications do, why the side effects occur, and how patients can better navigate their treatment journey without fear. Dr. Bina, good to have you this morning.
Good morning.
Okay, you've just covered like 4 states. It's okay. So let's understand the basics, okay?
Okay.
I'll start with, for the benefit of listeners, can you explain what glaucoma medications actually do and why they are critical in managing the disease?
Okay, thank you, Isi. You said something which is very important, It's like talking about eating the food, because we do eat. Without food, we don't survive. And then what you just said about glaucoma makes a lot of sense. And that's why we are worried as ophthalmologists, as eye care specialists. We keep raising this awareness. And we want to say again and again, thank you, Solid FM, for this social responsibility to our people. It is very important, Now, why is cancer a dreaded disease? Because it comes silently. My people say, when you are annoyed with a person and he keeps quiet, be careful. Something is wrong. Something wrong will happen.
Yeah.
And then if you're angry with somebody and the person reacts and two of you shout, it ends there. It has ended. But when you talk to somebody who is maybe senior to you and he keeps quiet, just know that something sinister may happen. So we talk about glaucoma as the silent thief of eyesight. That's, as we're speaking, there are people who have glaucoma but do not know they have glaucoma. They will only approach the doctor or come to the hospital once their vision once they become visually impaired. And this is what we want to avoid. Our people say, eme ngwa ngwa, eme orodachi. Asina esi n'ụtụtụ chụwa ewu ojii enweta ewu ojii. Ka a chụọ ewu ojii n'ụtụtụ ka chi hapụ iji maka it will blur vision. I mean, you can't see in darkness. And then we say this because glaucoma is here with us. As we speak, when you go through statistics, the Igbos suffer most from glaucoma worldwide. And that is why we're raising this awareness that our people should know that it is here with us. Don't be caught, unguarded. That is, do your best to have your eyes checked annually. Is there anything big in that? Having an annual check, you eat 2-3 times a day. You drive your car, you service your cars maybe once in 3 months and ensure that these cars are optimally working. Why don't you do that? That Osisina Mitampoloma should also take care of him or herself. And that's why these awareness are necessary. Now, glaucoma is the commonest cause of irreversible blindness. Underline the word irreversible.
Commonest.
And that we've said it is commonest among the blacks, that we've said. It is established. It is in all the literatures. And then we said in Africa is commonest in West Africa. And in the Nigerian study, check Google survey of visual impairment and blindness in Nigeria. It is clearly written that it is commonest among the Southeasterners. And these are facts, established facts. And then we are trying to raise the awareness, not for economic purposes, but to prevent, it is for the sake of people listening to me now. Because if you know what you gain by not going blind, then you will do your best not to go blind. The blindness that is preventable is the most annoying blindness because it could have been prevented, And we say 75% of blindness in sub-Saharan Africa are preventable. And that's why we keep raising this awareness. Now, if Solid FM does not do this, who would do it? And that's why we appreciate you for bringing this. So our people, the glaucoma is here with us. And then we talk about it weekly. Not that we are tired. I mean, I leave my time. We come here and do it for the sake of everybody. And we say, approach any established teaching hospital, any established private eye hospital that is run by an ophthalmologist, and have your eyes screened, checked annually, once a year. It does not take much. So it is just only appropriate that we do the needful. So Sayusi, what you are doing is appropriate and is a proper social responsibility that will yield fruits beyond our imagination.
Okay, I'll also want to ask whether all glaucoma medications are the same or do they work differently?
Okay, so let's, thank you, Sayusi. So let's go with the glaucoma medications. Now, for us to understand the complications, we also understand how it works, and then we know, we'll take them one after the other. Now, we'll go with the commonest, the beta blockers. The beta blockers block the beta receptors on the ciliary epithelium. Now, for glaucoma to occur, there's an imbalance in production of aqueous and drainage of aqueous. So, this helps in reducing intraocular pressure production, and thereby, for those who have very increased production, which is above drainage. By the time you use the beta blockers, you tend to balance the production and S-flows. Both the inflows and the S-flows are balanced. So the production and the drainage are balanced, and the pressures are normal. Now, if the production is above the drainage, pressures rise. Now, if the drainage is obstructed, so that there's also an imbalance. There's a normal production, but there's a reduced drainage. The pressures also so are high. And it is this increased pressure that destroys the optic nerve, the nerve of vision. And that's why we give these drugs. So for the beta blockers, they tend to reduce production, and that's how they work. Now, what is common about them? They can cause stinging. Because they're beta blockers, they affect the pulse. For those who are hypertensive, who already have low pulse, you don't give them the beta blockers, and they are the commonest and the cheapest and the most available. That's the one we call timolol, bitazolol. So they are the commonest, and then and they are the cheapest. And I said again, they are the most available. But because they have these issues, like for those who are hypertensive, who have low pulse rates, you try not to give them these beta blockers. And then they can also sting, sting the eyes. They can also cause redness. And then we talked about dry eyes. They can also cause dry eyes in some people. Now, we said they cause bradycardia. Bradycardia is slowed heart rate, and then can also reduce the blood pressure. So for people who are already having issues with blood pressure, and the pressure is low, and then the pulse rate is low, you don't give them beta blockers because they can also cause these diseases. They can also cause fatigue and headaches, So we don't give this, and then we tend to go to someone else. And that's why every person who has glaucoma must be seen by a medical doctor who has specialized. Apart from CCAs in medicine, you have also done CCAs in ophthalmology, doing just the eye and the entire body. So the person is well equipped. He's not managing you just as somebody who just read about the eye. No, he's managing you as somebody who knows the complete body, because there's no need treating the eye and affecting the general health. And people say, Azatan, Azawute. So you get the life, then you go to the eye. So you don't do something that you are trying to reduce pressure, but you're affecting the general health of the person. No, it's not proper. So that's why it is best managed by a medical doctor specialized in eye conditions. So then the other one is the alpha agonist, what we call alpha adrenergic receptors. Now these ones are beautiful in the sense that they reduce intraocular pressure production, aqueous humor production, and also increase drainage. So you can see they have dual function in reducing the intraocular pressure, and they're also neuroprotective. But they also have their issues. The issues of dry eyes. They can cause drowsiness. They can cause dry mouth, and then dry nose, and then some people say metallic taste, as if you put a metal iron in your mouth. They can really be, for the aged, these are serious issues that once they take it, they become very drowsy. So they begin to sleep anyhow, and somebody will ask whether they smoked something, So they can also cause stinging sensation, and they can also cause, some amount of discomfort. So for these ones, we say we will change, and that's why we take history before we administer these medications. And then for every drug you give to a patient, carry the patient along, see how this drug works, and see what may happen. Now, let me just say, generally, there's no medication without a complication. This is the truth. And then we should know that most times the positive effect of the drug outweighs the negative ones. Do you understand? That is what the drug accomplishes. It's like anti-malaria. Those days of chloroquine. It will scratch you, but all you want to get is to get healed. So you can manage the scratching for the three days. Though there are things you can now do to prevent the scratching. All I'm trying to say that most drugs have their complications, but most times the positive effect, the health effect, the advantages, overwhelm the disadvantages. So for a medical doctor, he carries you along. He makes sure this is what this drug will achieve. Now this drug, in achieving this, may cause these symptoms. And if they cause these symptoms, if you can overcome them, bear them. If you can't we'll have alternatives. So having said this, so we also have the one they call, we've talked about the beta blockers, the alpha adrenergic agents. We've talked about the so we'll talk about the carbonic anhydrase inhibitors. Now these affects the enzyme that helps in production of the aqueous. So if these blocks, because they're inhibitors, once they block the enzymes, they also block production of aqueous humor, and thereby reducing yeast production. So by doing that, there's now a balance and pressures are reduced. Now, this can cause a lot of things, apart from tingling sensations, people say otangwere. So the tingling sensations both in the hands and the feet, and they can cause fatigue. Now, this can be given as an eye drop, and it can also be given by mouth. That's the advantage for this. And then
orally?
Yes. So orally, yes. Also, the ones given by mouth is so wonderful because it helps in bringing the pressures down. But you see, another thing, you don't give it to people who have peptic ulcer disease, except their peptic ulcer are under control. It can now for us, because it can cause gastrointestinal upset and even worsen peptic ulcer disease. So, and then it can cause fatigue. Then it can cause frequent urination. So it is not good for the night. For the night, for the person to begin, hypertensive begins to, he won't have a proper rest and it has to wake up multiple times. Now, many times when we give this, we are giving it for purposes of bringing the pressure down almost immediately. Because we see that these pressures, especially when they come and the pressures are on the roof tops, so we want to bring them down. So that's when we give these carbonic anhydrase inhibitors. And then they can also come as combined medications with timolol, and then also with adrenergic alpha agonists. So it makes them good. We can also use them. But having said this, they can also cause that same stinging sensation. Can also cause dryness, in some people, and then irritation and discomfort. So this is what these carbonic anhydrase inhibitors can cause. Like I said, their advantages may most times overwhelm these disadvantages, and then these complications do not occur in all. Is as a percentage of people that will have this. In pharmacology, what you want to do is if you achieve a result with 90% of the population, you move ahead. Even if 10% or 5% will react to it, you still move ahead. So that people this 5%, once they react to the drug, then the drugs are stopped, and then you can go to other alternatives. So you wouldn't, because of the 5%, stop a medication that 90% of the population will benefit from. So we also have the miotics, what we call the cholinergic agonists. Okay. Also they also affect the enzymes that helps in production of the aqueous, and thereby they also cause pupillary constriction. Now, for those who have cataracts that are not significant, when you apply this, it may become significant because it will reduce the pupillary aperture, so that a cataract that is not, especially for those who have the one we call nuclear sclerosis, or the posterior subclavicular cataract, that are not how will I put it? That are not so. People do not feel the effect. They begin to feel the effect because the pupillary size of the pupillary size has now constricted, and therefore you do not have enough light passing through. So this cataract may blur vision. So it can cause blurring of vision, and then especially at night, they can also cause headache, and then also cause brow ache, and then it can also cause inflammation. The people who have the problem in fixing, especially those who read at night, may have difficulty trying to focus, on prints when they read. And then, like I said again, they blur the vision. But they also have their role they play, by virtue of pupillary constriction, they draw the the pupil away from the anterior chamber angle, so that there will be more drainage of aqueous. So these are what they do, and then these are their complications and side effects. We also have the Rho kinase inhibitors. These are the newer ones that are in the market now. Very, very rare in Nigeria. Common outside the country, but very rare in Nigeria. Also the Rho kinase inhibitors also affect the enzyme, and then when they affect these enzymes, this also help in smooth muscle relaxations. And when these muscles relax, the aqueous, the trabecular meshwork, there's an increased drainage too, and also affect production. So they can cause eye redness, cornea deposits, stinging, then small bleeds on the proper white eye. I hope I mentioned about the prostaglandin analogs. I think I've not mentioned that, so let me keep it last. Now, these have the most important effect when it comes to reducing pressures, because they reduce the intraocular pressure by using there are two major pathways where the aqueous humor is drained. One is the commonest, the trabecular meshwork. Now, the other one is the uvuscular pathway. That is where it plays its role, So that's from there, it also reduces intraocular pressure. Now, this given at night. So most people like it because given at night. But one annoying thing about it can cause redness. People begin to ask you, Yes, we know it can. Redness of the eyes. It can also affect skin color. Apart from the eyelid skin color can also change. Then it can also increase the lashes on the eyes, increases its growth, and then the eyelids can be droopy, and then eyes appear sunken. Now, like I said, it has the most potent effect in reducing intraocular pressure as per topical ones, but you can see this with this, you are worried. And then for very busy people, businessmen, very people who don't have time, is given to them because it's the best in the sense that it is at the head of your bed. Once you want to sleep, you just apply it, and it's once a day dosage. I mean, it makes a lot of sense. So that for a busy person, if you give him a drug that he has to use 3 times a day, he may forget because in trying to do this, do that, he forgets. But I mean, with these personal analogs, they're also the costliest, apart from just being apart from having the most potent effect. Now, for patients with very high intraocular pressures, we use what we call the mannitol, 20% mannitol, as an infusion, as a drip, to bring it down, because at that time, this is all you can do. The drops will not work as much as these hyper-osmolar agents. What do? They create an osmotic gradient between intraocular fluids and the blood vessels. So they tend to draw fluids away from the vitreous, from the aqueous, into the vessels. And then when the vitreous shrinks, it also helps in reducing intraocular pressure. So we love it when it comes to bringing the pressure down almost immediately. And for people who have intraocular pressures and then you need to operate on them, this mannitol is put up so that as it goes, the pressure is maintained. So you don't have terrible complications, and then your bleeding will be minimal. So the mannitol, the hypoosmolar agents, also have the most potent effect in reducing intraocular pressure. And it's very dramatic. And then we use it for people who come in with their pressures high, or people who come in with very high pressures and they complain of headache. They can't, so much headache because they thought this headache was typhoid or malaria. And for a week or two, they've been treating typhoid and malaria. And because the lab said there is malaria tuberculosis, and then there is this thing is vital is 320 and 600. So these are things that people face, not knowing that something else is causing this increased pressure. So when they come, this is what we give. Now, these are by listing these drugs and how they function, we have also listed the way they can cause complications. Now, it is only appropriate that when you are giving intraocular medications, it is only appropriate that you carry a doctor along for every symptom that is unusual, that you've not had before you started using that medication. Please relate to your doctor. Don't stop the medication without telling your doctor. It is only appropriate that you do the needful. The doctors should be kept aware of what you are going through. Don't ever stop. Now, if you experience any side effect, like I said, or that are bothersome or concerning any part of the eye, or even in the general body, don't say, no, it's an eye drop. It is not the one causing this pain. No, let your doctor know. If you have sudden eye pain, then there's nausea, vomiting, the vision becomes foggy, or you have colors around lights, what we call halos, after starting an medication, please come immediately. Now if you have a history of asthma or airway disease, let's just come. Don't just wait. Inform the doctors for whatever drugs, then we'll discuss with you. Now, never stop taking your drug medications suddenly unless your doctor instructs you to do so. So it's only appropriate that people do what is needful. Having said this, it is only good. You can ask a doctor for his number. Then if he says, please don't call, send text messages or WhatsApp messages so that he can respond to you once he's free. And then do not forget to put your name and why you came. And then it's also good for patients to ask the ophthalmologist, doctor, what is wrong with my eyes? So that he will explain to you and tell you the diagnosis. And that way you are carried along. And then your doctor is carried along so that when you speak to him, look, I am so. Look, the diagnosis that was made. Look at the drugs you placed me on. And look at what I'm having now. I mean, it makes a lot of sense. He will respond almost immediately. Thank you.
Okay, I will also want to, it's been a lot of explanation. I can also hope that those who are listening were not confused by the some of the jargon. Some of them are just unavoidable.
Chris, I've tried to use some common words.
Yes. So why do these side effects occur? Is it the drug itself, the preservatives, or the patient's body responding to the drugs?
Okay, we know that that was what I tried to talk about, how these drugs function. They what we call pharmacodynamics. How do they function? Now we know that in some drugs to function, as they are achieving this positive aim, they are also interacting with other parts of the body and causing some discomfort or symptoms. Now, there are people whose bodies are allergic to certain agents. And we will always say, if you will look at the literature look at the literature, they will tell you if your body is allergic to this. Now, like sulfonamides, sulfurs, the quinolones, the quinines, they say if your body is allergic to this drug contains it, please do not use. Look for alternatives. Now, these are reasons why these drugs may happen. Now, very importantly, you mentioned something about these drugs have what we call preservatives. That there are some agents that protect this drug and keep them very active. Now, these drugs, these agents that keep them active, are what keeps them active. Now, in some people, some of these drugs have been done without these agents that keep them active. And therefore, for people who react to those agents, that is the common one is the beconium hydroxide. That is what the BAK, that's what we use mostly in keeping the tropical drugs active. That is the agent where they are kept, that keeps them active. So some people also react to these agents. We know this. So, but you will only know when you administer it. You will not know by barely looking at the patient and say your mustache looks like somebody who no. It's only when you see when the patient reacts that you know, okay, you now say, okay, like I'll ask them, could you manage it? Is it the stinging sensation? Is it something? How many seconds? They say just 2 seconds. I said 2 seconds. Do it. Because giving you this other one. Now, when we give drugs, why do we give drugs? We give the ones that can achieve our aim. We give ones that are available. Then we also consider costs of medications. Now, there's an eye drop of 2,000. The root kinase inhibitor will cost about 100,000. Do you understand? I don't know. So you can imagine. No. So if I give you one of 2,000 and it just stings you, I would want you to like nah. Don't you think he can bear this? Do you want us to go to that of 35,000? Can you check a pocket too? For me, the stinging sensation of the pocket may be more because it will only be 2 seconds.
Yeah.
So why not you bear the 2 seconds stinging than the one that lasts 24 hours, a day? So because it makes you spend more. And these drugs are not just for a month; they're for a lifetime.
Okay, let me ask. The side effects. Do they have any damaging effect?
Yes. Okay. So some side effects may have damage. So it depends on mild, moderate, severe, and life-threatening.
And in that case, you discontinue it.
Yes.
Right?
So, and that's why for us to give beta blockers, we must ask certain questions. Do you have asthma? Do you have any chronic obstructive airway disease? Are you diabetic? Are you hypertensive? Have you ever had low BP? Are your pulse low? These questions are what a medical doctor will know and will ask. These are routine. So you don't give medications without asking basic questions, because the worst you can do, like I said, first law for a medical doctor is to preserve life. Then for the ophthalmologist, you preserve life first. Then you not manage the eyes, because it's only the living that see. So you will not, because you want to manage the eye, cause something that can cause death. So you are So you grade these complications to mild, moderate, severe, and life-threatening. Now, these life-threatening ones are things you must ask questions about. And that's what I talk about. You want to give somebody diamos, you must ask that question about peptic ulcer disease, stomach upset. Are you dyspeptic? Do you have dyspepsia always? Do you feel like you have how will I put it again? Just anything that has to do with your gastrointestinal system. So you want to ask these questions because it matters before you administer these medications. And then always leave that order. Please, if there's anything, get back to me. It makes a lot of sense. So, yes, they can be life-threatening. They can also be very severe. They can also cause damage in another part of the body, because it is unintentional. The doctor meant well. He never knew this will happen to you. Like I said again, that some of these drugs come with about 80%, 90% assurance that, the general population will tolerate it and it will achieve their aim. But in some, let's say 10%, 5%, 1%, that it may become, maybe say 0.5% may become life-threatening to 0.5%. Now, you are not going to stop this drug because 0.5% may have life-threatening conditions. Good enough for that person to have, the person will have some underlying conditions that will make it life-threatening. And that's why we ask about these questions, about your blood pressure, about your pulse. In any way, in any standard eye clinic, blood pressures are measured, pulse are measured. These things are very, very important. We must measure them so that even when the doctor is asking you that question, he's looking at your blood pressure, he's looking at your pulse. So it makes sense. So then, most of these things are what we call idiosyncrasies. Now, you do not know those who react negatively, and you will not, because the person will not, tolerate it. You have to administer it first, and that's why most times it does not become life-threatening on first installation of the drugs. No, it is,
and that's why you have to be in touch with
the doctor. So it is that you've, like somebody I saw yesterday with retinal detachment. Why I'm not happy is that he lost his first eye from retinal detachment, and then
he didn't present it.
Yes, then so you've lost first eye. Then second eye, you started having reduced pressure. Reduced vision. It was increasing by the day. What it was yesterday, today it got worse today, and then for tomorrow it gets worse again. It's not for you to run to the hospital as soon as you can. Why wait for 2 good weeks to come to the hospital for an only eye? So you see, for those who come up with very severe symptoms and life-threatening ones, the drug started giving them signs earlier. They had symptoms earlier. which should have made them approach the doctor or come to the hospital. If you can't get the doctor, he doesn't respond, come straight to the hospital, because these hospitals are manned 24 hours, 7 days in a week. So there's somebody there. That same person has the same knowledge of the first doctor who saw you, so he knows what to do. So they come. So like I said, so when patients come with drugs, you withdraw the one that caused symptoms and change it and say, this same one that I'm giving you is not an angel. It's going to do some work, but see, it could cause this, it could cause this. If it happens, please let's. Now there are people whose eyes are very choosy, very annoying. And people say, Ebuni, no. Ebudana, no. Yes, Uzumabeke. So those people, you talk about lasers. Lasers do not work. You do surgery, because at that time, almost all classes of medications, we use the four major classes are the beta blockers, the alpha agonists, the carbonic anhydrase inhibitors, the prostaglandin analogs. These are the 4 common ones we use. Now, if your eyes react to this negatively, you have moderate to severe complications or life-threatening, you talk about surgery or lasers and surgery immediately. So like for people who okay, maybe we'll talk about those who are pregnant. Maybe next time we'll talk about pregnant people. Okay. Yes, because most of these drugs affect the baby in the womb. So we would advise them, see, before you take in, let's do this or this before you take in, because you will not administer these drugs when you are pregnant.
Because of how expedient it is, you might just want to talk a little bit about what it could do to a pregnant woman.
Yes, no. They affect all of them. The beta blockers, the alpha agonists, because they cross the placenta, and affect the baby. Some reduce, especially the alpha agonists, reduce the baby's heart rate too. Like we said, and then the beta blockers, if it does it to an adult, can also do it to a child in the womb.
Wow.
So these things it's not proper for you to come to us when you are pregnant that you have glaucoma. Best thing is we just do lasers at that moment to see if we can bring a patient down at that moment, because almost all eye drops
has side effects.
Yes, has side effects, and they can also affect the baby. So we need to prepare you before you take in. Thank you.
We have a friend in the studio, and of course normally he calls in. So also, Jay.
Sir.
Good to have you.
You're welcome.
So,
thank you.
You can't see properly. Do you see at all?
Well, I just see just small.
Just small.
Just small. I only see that light for that listen. But I don't know whether anything there my front towards the time I touch I raise my hand before I see this. You see?
Okay. So how did you come? Some people helped you to navigate?
Yes, I come out for bus stop. I enter motor. Luckily, from Ibagwanike.
Okay.
I see motor coming from Suka.
Okay.
I say I'm going to Noas. They say he's not dropping for Noas, but he's going to Outback. I said very good. Drop me for Solid FM. When they dropped me there, the conductor took me to the gate.
Okay.
And I meet the gate man who took me to.
So how did you? What is wrong with your eyes?
The thing started almost 5 years ago, just gradually. Then when I go to hospital, I even come to Park Lane here. They tell me some more other things. I go to other places. When Park Lane people come to Catholic Church at Ibagwanike, they give me some drug. Then I later go to Miss Subakala Temele, that Holland woman over there. Then I paid 10,000 naira for getting card. He give me some medicine. That time he said this left.
That time were you still seeing?
Yes, small. He said, but this one don't damage. But I'm managing this one 5%. Later when I put the medicine, this one could close. The one of 5% close. The one where he say it don't damage, I carry that one they see. Then it was then I left that place due to some other things, financial problem. When I beg some people money, they may give me 2,000, which is not up to the tablet or any other, or even transport. Gradually, the eye they come. I go to different hospital, but before then, it was the thing has already go down.
What did they say is wrong with your eyes?
They say na glaucoma.
Glaucoma, okay.
Yes, I traveled to one hospital at Abakaliki. The Igbo people just food that place. Those one tell me say the thing has the pressure of that place. They cannot operate it again. So let me continue the medicine. But when I check the transport from here to that place, Okada will go carry me for Isheke to that place. We wait for me till whether at 5 o'clock. I go carry me come back, which is a big money to me. I come back again. Now where I'm going to now, hospital and Nsuka. Then when I go to Nsuka after OP Junction, getting to Peace Park. This is the this is the card. Then when I go to that place, they give me medicine. I do test. Then give me amount of money to pay for collecting medicine. I don't have that money that time. I can't spend 2 weeks before the man who is helping me. The man is in France. He send money for me again. I can't go. When I go back, I collect the medicine. Only 2 eye drop and 30 pieces of tablet. He say I should divide that tablet into 2, 1 for night, 1 for morning. Then when he finished, I will come back on 26th of last month. As of now, I don't have money even to go back for checkup. And since that time, the eye is even going down more than as it was before. Just like this guy is explaining now. So I'm supposed to report to them that the eye is going down more than as it is. Because, one, I have other problem in the body, which some people they explain. When I hear some people they explain for radio, pretending that glaucoma something will go cause that thing. I have ulcer, then I have infection for body. That infection always small time I have pains. When I take ibuprofen, it cannot go. Sometimes my body, sometimes all my body go cause swallow up. Small time that one don't go. So I don't know because I never explained that one to the place where I go for hospital. We give me the medicine. Whether I can rise and make it come, they worse than as it was now. So I need to go hospital again for checkup, or to leave that place again, try find that place.
Maybe doctor will have to look at you before you go back.
Yes.
Okay, let's take some calls. If you're out there, let's talk with the doctor before our time is up. 0909 771 1009. Sometimes you hear people's voices on radio. You don't know what they are going through. Now we've seen that old soldier that sounds very
strong.
Very strong. It's going through a whole lot. 0704 550 2840 or 0909 771 1009. So, Doc, how do you respond to what he has just said?
Osoja, good morning. Dalo.
Yes, sir.
Okay, the truth is this, that glaucoma is a progressive disease. And then when we now say, Osoja, you can actually advise our people. You are the one that should be talking to our people. Yes. You know, that's now, when you come early, let me give you, I keep saying this thing. My mom has glaucoma. She has had glaucoma for more than 25 years. You know, and she's okay. I mean, she watches her television. She doesn't need anybody's help. She's 82 now.
82?
Yes.
Okay.
Yes, if not for the way we stop, she can drive. You know, because we caught her on time. You know, we've done surgeries. You started with UNTH, did surgery for glaucoma for her. You know, and then that controlled her pressure. Then over the years, it continued. She didn't use any medication. Then, you know, with time, it started going down because that surgery will definitely go down over the years. But it may last, say, 7 to 15 years. Her own lasted quite long, you know, almost 15 years. And that was about the best. And I'll tell you that those who did this abroad were not better than her. One got blind and died in the US, but she's doing well. The surgery was repeated at UNTH at TESH last year, you know, and she has had multiple surgery, and then she uses her drugs well. Now, the biggest issue is because these drugs cost money, and our people, and then when you are using the drug, it does not improve your vision. What the drugs does is to protect what you have.
What is left.
Yeah, what is left. And we keep telling our people, you know, I use the word, I said, on irreversible disease. Underline the word irreversible. Also underline the word progressive. You know, it's a chronic progressive disease. Now, when you are using the drug, you are trying to stem the tide. You are trying to block the progression or reduce the progression to minimal progression so that this person can have his vision all his life. Now, when people use eye drops, it costs them money. We know. And they don't see an improved, in parentheses, an improved effect. And they're like, when since there's no improvement. And they forget that we told them ab initio that what we are doing is to protect what you have. Anywhere you go in the world, the UK, the US, it is the same thing.
And that's why going for checkup is important.
It's very important. So we keep saying this. And then more important is the fact that people should come on time. Now, if you come because you are itching the eyes or because you can't read prints and we say, oh, you have glaucoma, you are blessed. Now, for anybody coming just for a checkup and the guy says, okay, now you have glaucoma, and we say, okay, it's a mild one, and we'll start on time to treat you. They are definitely not going blind. You're definitely not going blind, and then at that moment you're not visually impaired. At that moment you are still doing well. Then we maintain what you have. If the pressure cannot be controlled by drug, we do surgeries. So our people should realize this. Don't come when it is too late. When your pressures, when everywhere has blocked, to manage the pressure, it becomes difficult. Instead of using one eye drop, we're now using 4. Can you imagine? So what would have used one drug to maintain, we're now using 4. So if you're buying the drug at 5,000, 4 times 5 will be give you what? 20. So that's what causes the problem. If you come late, the more the treatment and the costlier it becomes, and the more difficult it is to manage. But if you come early, we catch you on time, we do the needful, and you don't go blind. So people say nambuchoria kogugoya. These are what our people say. They've said this out of years of experience for our elders to come up with this. Nambuchoria kogugoya. So it is the same thing we're saying, pleading with our people, begging our people. It costs you nothing. If you have a car, I keep saying it, and you maintain it, then maintain you yourself.
People maintain their cars.
Needs to be maintained too. Needs to be pruned. Needs to be, things. You can't tell me that you are wealthy or you've gone to school and you can't do the basics. You can't come to hospital to have your eyes checked. Now, let me just say, frankly speaking, if the first day the person, there's a breast cancer, that first day the cancer becomes, the lump becomes cancerous. If you remove it, the person is healed of cancer. But because the person does not do the needful, and it spreads, but once it spreads, we're waiting for time for the person to die. And then it becomes quite costly to treat. You do this radiotherapy. Go and ask them the cost of those such medications. Same thing with glaucoma. Same thing with uncontrolled blood pressure. If you don't control your pressure when you could have done it earlier, it becomes annoying. When now pressures are above 200, things are getting worse. So we talk to our people. We plead with our people. Rather, you see, it takes time it takes 2 hours. What's 2 hours? About 2.5 hours to 3 hours to watch a football match. And our people do this regularly.
Is enough to do checkup?
Yes, it's enough to do checkup. Once in a year. It's enough to do checkup. People are looking forward to tomorrow's matches.
Okay. I don't know. If you're listening and you have a question for the doctor, you have to be fast. We just have 5 minutes remaining. Before we go, 0704 550 2840, 0909 771 1009. These are the numbers you can call. So are there newer medications or treatment approaches that have fewer side effects?
Yes, the lasers that have come now have fewer side effects. I tell you, quite fewer side effects, and it's done at that moment. If there's any problem, it shows at that moment, and it is taken care of. You know, it doesn't. I mean, it doesn't like medication that will use for a lifetime. Once done, you know, it helps achieve our purpose. And it can be one thing about lasers. If it doesn't achieve our aim, it can be done multiple times.
Okay, we have a program coming up, so closing remarks.
Yes. Okay, so our people, I don't know what else to say than na nka dị na ntị, na ndụ dịkwa na ntị. I know in the scriptures Christ will say, let those who have ears hear. Nothing else to say what we have said earlier. Akọlụ ọmalụ ọmalụ, akọlụ ofeke
Itinye isi n'ọfịa.
eme ngwa ngwa eme ọrọdachi. Daalụ.
Thank you, Dr. Obina.